current hospital response model, particularly in emergency departments, faces considerable pressure due to population aging, the clinical and social complexity of patients, and insufficient coordination between the different levels of care. Many users are referred to the emergency department because of the lack of alternative responses in primary health care and palliative care, as well as the absence of structured support within social sector institutions. Although the emergency service addresses the acute condition presented at the time, it does not ensure continuous follow-up to prevent future episodes, nor does it guarantee adequate subsequent clinical monitoring. The persistence of the current model of emergency department overuse also results in lower levels of quality and humanization of care, significant pressure on professionals working in emergency departments, and high costs for the National Health Service. It is imperative to implement new models of coordination between healthcare and the social sector, with the aim of serving the population more effectively, with higher quality and lower costs. Municipalities have also been involved, as they play a fundamental role in strengthening public social responses through the implementation of community-based social programs. Security forces, namely the Public Security Police and the National Republican Guard, are also engaged in the project, contributing to the identification of cases of violence, to be jointly followed up by the local health unit and social institutions. Specifically, this new model seeks to establish a methodology of coordination between healthcare and social services to ensure an integrated, humanized, efficient, and needs-based response for users in situations of clinical and social vulnerability. Firstly, we provide a rapid communication channel to their family medicine team, doctor and nurse, in primary health care, and secondly, for more complex cases, a multidisciplinary team composed of a family doctor specialized in complex patients, an internist, a nurse, a social worker, and a nutritionist. This new methodology allows us to address the needs of the population in an integrated and community-based manner, avoiding the need for emergency department use or hospital admission. The implementation of this model has made it possible to reduce the number of patients in emergency departments and hospital wards, ensuring integrated clinical follow-up, family doctor and internist, at home, private residence or care home. The model also enables more effective coordination of social services with all social sector institutions within the area covered by the Baixo Mondego local health unit, ensuring greater personalization of social care in line with users' needs and the available social offers. In this way, direct and efficient communication between hospital social services and community social institutions has been promoted. The scalability of this model is easily achievable, as it essentially involves reorganizing patient access pathways and service provision. The digital platform in use is owned by the Baixo Mondego local health unit, and for this reason it can be readily made available for use by other institutions. In this way, it has been possible to improve users' quality of life with solutions that are local and tailored to their specific reality. Our project aims to ensure that all users requiring healthcare or social care, regardless of the geographical location, have access to such services. It plays an even more significant role among disadvantaged populations, as it guarantees that citizens do not need to search for social support options themselves. Instead, the local health unit, in coordination with social sector partners and municipalities, identifies the most appropriate solutions for their specific needs. The model prioritizes community-based care, keeping users at home whenever possible, in their own residence or in care homes. In this way, we ensure that there are no barriers to accessing quality healthcare and social support, regardless of whether users live in rural or urban contexts.